So we'll start by taking our national anthem for the sake of having both Muslims and Christians and other religion here. So we'll start by taking the first and second standard of our national anthem. Kindly project the national anthem so that we can recite it together. Okay, on a count of 3, we can start from the first stanza. 1, 2, 3, go. Nigeria, we hail thee.
Nigeria, we hail thee. Our own dear native land.
Though tribe
and tongues may differ,
in brotherhood
we stand. Nigerians all are proud to serve our sovereign motherland. Our flag shall be a symbol that truth and justice reign. In peace or battle honored, peace we count as gain.
To hand
on to our children
a banner
without stain.
O God of all creation, grant this our one request. Help us to build a nation where no man is oppressed, and so with peace and plenty, Nigeria may be blessed. Amen. Amen. Okay, thank you everyone for joining. So as a matter of introduction, this is emergency contraceptive webinar with our focus on Postinor-2 levonorgestrel brand. Emergency contraception remains one of the most misunderstood areas of reproductive health in Nigeria. And this is why we are having this webinar to enlighten people, the public, and also Postinor-2 is our brand, and also to enlighten people about this product. And we are going to be having 2 leading consultants, obstetricians and gynecologists, to break down these facts, to debunk the myths, a lot of myths, misconception about emergency contraception, and also discuss the safety and effectiveness of emergency contraception. Whether you are a health professional, a pharmacist, a student, even a market woman, this webinar is needed for you because you are going to be learning more about women's health, and all the questions, the misconceptions that you've had over the years will be corrected. So we're going to do an introduction of SFH Access. This webinar is hosted by SFH Access. So we're going to introduce SFH Access to you so that you can know more about us, our services, and what we do. So SFH Access to Health Limited by Guarantee is a subsidiary of the Society for Family Health. It's a leading non-governmental organization in Nigeria. And our mission is to provide sustainable access to health products and services across several diseases areas. We work with stakeholders to address equity gap and the determinants of health. At SFH Access, we believe in transforming the markets by delivering customers-focused health solutions. We use our long-standing understanding of building the total market and technology to drive delivery with minimal financial impact on the customer. We achieved this through unique, innovative funding, strategic partnership, the use of technology, a deep understanding of the local landscape, and leveraging our brand equity and quality. We promote inclusivity and ensure that everyone can access the health products and services of the highest quality. We are committed to maintaining and building the total market in our core product category while prioritizing both rural and urban access. And I know you'll be wondering that what are the products that we offer in SFH Access? So I'm going to be talking about the key activities of our SFH Access. To start, let me start from our products. Our products are very popular. They are products that you might have used and you will not know that they are from SFH Access. We have our condom brand, Good Cycle condom, lifestyle condom, flex condoms that comes in different variants. And we have our emergency contraceptive pill, which is the Postinor-2. And we have our anti-malaria brand, which is Top Mal. We have our products targeted at the treatment of non-communicable diseases, hypertension, diabetes, and other heart conditions. We have Vasetan, 80 and 160 milligram. We have Temisatan, 40 and 80 milligram. We have metformin plus glibenclamide combination. Also, we have products targeted at our water treatment products. We have water guards. We also have water guards tank disinfectants. And we also have other FP commodities such as Jardel and the rest of them. So let me talk about our health commodity supply chain and logistics. Powered by a robust logistics business, SFH Access oversees procurement, warehousing, distribution, and delivering of public health commodities across Nigeria. So if you are looking for any of these services, you can reach out to us. Also, we have our telemedicine platform called Access Care. This is to ensure that our community have access to medicine programming, offering services to reproductive health, maternal, neonatal, child health, nutrition, malaria, NCDs, and others. Then also, we have our digital health portfolio, and we have a lot of services tailored at the age and others. So this is a little short bit about SFH Access. So in the course of this webinar, if you have any question about the presentation, about our products, about our services, you can drop a message at the chat box. We'll respond to you. I will answer your questions. So for today's webinar, we have two powerful speakers with us, Dr. Bolutife Idowu and Dr. Baba Lafia, and they are both consultant gynecologists. So to go forward, we are going to welcome them into our midst by just giving them a minute to say hi to us, then before we do the introduction. So Dr. Bolutife Idowu, just say hi to all of us. Let us know you are here. And also Dr. Baba Lafia, before we do an introduction.
Good morning. Can you hear me?
Yeah, good morning, sir. Good morning. It's good to have you here. Thank you for joining. Thank you. Okay, thank you. We are happy that our guest speaker is here. Also, we'd like to hear from our second speaker, Dr. Baba Lafia. We want to be sure she's here. Hello? Hello, can you hear me, ma? Dr. Baba Lafia.
Stephen, let's show you she has the right link.
Okay, so while we are waiting for her to join, we'll do an introduction. Okay.
Good morning, I am around.
Okay.
Okay.
Okay, good morning, ma. Good morning. It's good to have you. It's good to have you. Okay, we need more people in the group. So please, if you're already in the meeting, tell your friends, tell your sisters, tell your cousins, because they are going to learn a lot. Their misconception and their myths are going to be corrected. So let me start by introducing our guest speaker. I will start with Dr. Bolutife Idowu. He's a seasoned physician, consultant, leader, and trainer with over 12 years of experience. He's a fellow, National Postgraduate Medical College of Nigeria, an associate member, Royal College of Obstetrics and Gynecology, and became a member, West African College of Surgeons, OBGYN Part 1 in 2015. Currently, Dr. Idowu serves as the lead consultant gynecologist and obstetrician and clinical director, Redington Hospital, Lekki. Formerly, he served as consultant obstetrician at the Nigerian Air Force Mother and Child Hospital, Badagry, where he led health campaigns for Nigeria Police, Immigration Service, and Navy personnel, educating pregnant women, healthcare workers, and running family planning clinics aimed at driving improvement in care. Dr. Idowu earned his MBBS from Ladoke Akintola University of Technology, Ogbomoso, Oyo State. He completed his housemanship at Ladoke Akintola University Teaching Hospital, Osogbo, and held medical officer positions at Bowen University Health Center, Iwo, Osun State, and Abake Medical Center, Osogbo. Dr. Idowu began his residency program at Ladoke Akintola University Teaching Hospital, Osogbo, and completed it at the Obafemi Awolowo University Teaching Hospital, Ile-Ife. In addition to his medical qualifications, Dr. Idowu has bagged several certifications, including Leadership and Management in Health Professional Development, 2018 from the University of Washington, USA, a certification in Gynecology Ultrasonography from the University of Benin, Infection Prevention and Control in Maternal and Neonatal Care by WHO, Laparoscopy and Hysteroscopy certifications from Kiel School of Minimal Access Surgery, Germany, BLS and ACLS certifications from the American Heart Association in 2023, to mention but a few. As part of his commitment to driving improvement in quality of maternal care, Dr. Idowu gives regular presentations at SOGON conferences contributing to knowledge sharing. So thank you very much. So this is a brief introduction of one of our speakers. So I'll go to a brief introduction of the second speaker, then we'll get into the business of the day. Dr. Baba had undergraduate in ABU Zaria, where she obtained her MBBS in 1991. Her postgraduate education was also done in ABU Zaria, where she became a fellow in WASC in Obin Aga in 2008. She attended the prestigious National Institute for Policy and Strategy Studies, Kuru, Jos 2023. Work experience: she has senior registrar to medical officer roles, multiple institutions, Ahmadu Bello University Teaching Hospital and affiliate 1992 to 2009, obstetrician and gynecologist, Mary Stopes, Nigeria, Abuja, from March 2009 to October 2011, PMTCT lead, Rich Project, E&F Management Consult Limited, Abuja, October 2011 to November 2012, consultant obstetrics and gynecologist, Dr. Hassan Clinic, Maitama, Abuja, December 2012 to November 2013, consultant obstetrician and gynecologist, Nigeria Customs Service Hospital, Karu, Abuja, December 2013 to present, certifications and licensures, fellow West African College of Surgeons, registered with Medical and Dental Council of Nigeria, advanced laparoscopy training 2016, abdominal ultrasound training Dubai 2015, and others, professional membership, member of the alumni, and others. The list is so long. So that we can have time to entertain our questions, to learn, I'm going to end here. It's a long list. So this is to tell you that we have authorities in this area who will be ready to diversify the topic. So we are going to invite, without wasting time, we're going to invite the first speaker of the day, which is Dr. Baba Lafia, and she's going to be talking to us about effectiveness and safety of emergency contraceptive. And she's going to do this for 20 minutes. So let's welcome her and give her the room to talk to us. Hello, Ma, over to you.
Yeah, good morning, Madam Onoriade. Thank you for your kind words.
Thank you, Ma.
Good morning, everybody. Afternoon, evening, I guess, depending on where we are all sighted. Yeah. Well, the topic of presentation this morning is emergency contraception, effectiveness and safety. I will run us through. Is my slide showing? Or should I continue?
Continue, ma. The slides will be shared. Stevie, can you share
the outline I'll show us through the introduction, the definition, indication, characteristics of emergency contraception types, medical eligibility, mechanism of action, effectiveness, and safety of emergency then side effects. As a matter of introduction, approximately 121 million unintended pregnancies occur annually, which results to about 25 million unsafe abortions worldwide. And out of this unsafe abortion leads to 37,310 maternal deaths annually. Although there's positive of data from Africa and Nigeria, but we all know that from previous experiences, Africa contributes almost 70% of these morbidities and mortalities, of which Nigeria contributes 50%. Unintended pregnancy is a major public health problem that affects individuals and society. It is associated with increased health risks to both mother and fetus. The likelihood of a woman getting pregnant after a single episode of unprotected intercourse is highly variable depending on the timing and other factors. But all women and girls at risk of unintended pregnancy have a right to access emergency contraception. Emergency contraception has the potential to reduce the incidence of unintended pregnancy and unsafe abortion, as well as decrease the rate of maternal mortality and morbidity. So emergency contraception should be integrated into healthcare services, but there's word of caution. We should note that this does not protect against sexually transmitted diseases, and it should not replace the regular contraceptives available. So what is emergency contraception? It is the use of a medication or device to prevent pregnancy following unprotected sexual intercourse. Some people call it morning after pills, backup, and we should also know that it is not effective when taken before unprotected sexual intercourse, because that is not the intention. The intention is to use it as a backup to prevent unwanted pregnancy after unprotected sex. What are the indications for emergency contraception? It is indicated when no regular contraceptive is being used and the woman is exposed to unprotected sex. When there is sexual assault, like for a woman who is not protected, like we have a case of rape, contraceptive failure from improper use. And this improper use could range from condom breakage or slippage or incorrect use. When there are 3 or more consecutive missed combined oral contraceptive pills, that's a woman misses her pills for 3 consecutive days, or she takes it 3 days later during the first week of her cycle. When she's more than 3 hours late from the usual time of taking progestogen mini pills, or 27 hours later than the previous pill, or when she's 2 weeks late from taking her Noristeral, that's progestogen oral only injections, or 4 weeks late from taking the depot medroxyprogesterone acetate. For women who are on withdrawal methods, maybe there's failed withdrawal, or the external genitalia is stained with specimen. There's dislodgement, breakage, or tearing of the cervical cap for those who are using cervical cap. If there's expulsion of intrauterine contraceptive device or hormonal contraceptive implants, or for people who are using the abstinence method, maybe they've miscalculated, then it is indicated that they cover themselves with emergency contraceptive. What are the characteristics of the emergency contraceptive pills? It is safe and effective. It's easy to use and widely available. Most of them are over-the-counter drugs. They are more effective if taken as early as possible within 12 to 24 hours of unprotected sex. They can be taken at any time during the monthly cycle. A physical examination is not usually required, and no STI protection, as I said earlier on. What are the types of emergency contraception? We have hormonal and non-hormonal. For the hormonal contraceptives, the first and famous that we've also known is that's the combined oral, which is the USP regime. Then we have the levonorgestrone only pills. Then we have progesterone receptor modulators. For the combined oral contraceptive with the use period, although not commonly used these days, it contains both estrogen and progestogen, and you need to take high dose pill. If you're using the current combined oral contraceptive, depending on the day, you may need to take 2, 3, 4 tablets to be able to, because you need a dose of 100 microgram of ethylene estradiol plus 0.5 milligram of levonorgestrel to be taken, and then you not take it 12 hours apart, and must be taken within 72 hours. But this regime has the side effect of nausea and vomiting. Sometimes you may even have to give antiemetic an hour before the patient takes it. And when vomiting occurs, within 2 hours, you have to repeat the dose. And the pregnancy rate ranges from 0.2 to 3.2%. As I've said earlier, it's no longer commonly used because of this side effect, and there are other safer methods now. That takes us to the levonorgestrel only pill. The use of progestogen only for MI was first proposed in 1973. It is usually taken either as a single dose of 1.5 milligram, or alternatively, you break it into 2, taking it as 0.75 milligram each, 12 hours apart, within 72 hours of unprotected sexual intercourse. Examples are the Postinor, which we just had the earlier talk mentioned. We have the Levonorgestrel-2. The LNG had a pregnancy rate of 1.2 to 2.1%. You can see it's even more effective than the other one, and it has lesser side effects. And it will normally resolve even without medication. Then we have the progesterone receptor, but these are newer incomes into the newer regimes into the emerging contraception cycle. We have mifepristone, 10 to 50 milligrams single dose. It was approved by the United States Food and Drug Administration in 2000. Not commonly used because misoprostol is used for in obstetrics and for postpartum hemorrhage abortion. It's so it's not usually used and not widely used for that. The other is ulipristal acetate, which is 30 milligram single oral dose. It was approved in 2009. It is effective up to 120 hours. That's 5 days after unprotected intercourse. But the thing with it is that you need prescription to get this. And I don't think this is widely available. It's not available in Nigeria. Except for those who travel abroad, probably bring it in. The pregnancy rate is about 1.2%, and it may cause delay in the menstrual cycle. The non-hormonal, which is the copper T now, intrauterine contraceptive device, usually placed by a trained. This one is usually provider dependent because it needs to be given to you by a trained clinician. It can be inserted up to 7 days of unprotected intercourse. It can be placed at any point of the menstrual cycle if pregnancy has been ruled out, and is 99% effective in reducing pregnancy risk. And it can be continued as a long-term active contraception. Now, this brings me to medical eligibility. Emergency contraception is generally safe and can be used by most women. Mostly, there's usually no age restriction. However, specific medical eligibility criteria can vary based on the method of emergency contraception chosen. Here are typical eligibility criteria for most common types, the ones I've mentioned earlier. For the UC regime, it involves high dose of oral regular contraceptive, not commonly used this, as I said, so I don't want to waste time on that. Then our levonorgestrel emergency contraceptive pills, which we have the Plan B next, Postinor in this group, is suitable for most women, including those who may not tolerate estrogen very well. It can be used at any time in the menstrual cycle. There's no age restriction. I told you it has fewer side effects. Then the ulipristal acetate, which I told you earlier is prescription-based. You have to get the prescription from a doctor. It's suitable for most women, no age restriction, but it is contraindicated in patients on rifampicin or anticonvulsant drugs. And usually, you have to be sure that patient is not pregnant because it does not abort. It's not breastfeeding mother. The special thing about it is that though it's not contraindicated in breastfeeding, but when a woman takes this drug, she needs to stop breastfeeding for like 36 hours before she can continue breastfeeding. And in liver disease, it's not advisable. Then the copper T I talked about earlier. What's the eligibility criteria for copper T? Copper T can be used as inserted within 7 days of unprotected intercourse, suitable for most women, but a healthcare provider will have to evaluate individual needs and risks, because if a patient has pelvic infection, it's not active pelvic infection, it's not advisable. If uterine anomalies exist, it's not advisable to put copper T. You have to give other methods. What are the mechanisms of action of these various methods? For the hormonal methods, it's been suggested that the hormonal method acts by delaying or inhibiting ovulation or by disrupting the formation of the corpus luteum. Disruption of normal follicle development or maturation. It can prevent transport of the sperm and the ovum because of the changes it does to the cervical mucus and the parts. Then for the hormonal method, it prevents fertilization, and it can also prevent implantation, which made it very unsuitable because it altered the endometrial lining of the uterus, which makes it very unsuitable for implantation. This brings me to effectiveness. This arrow you're seeing shows that the effectiveness increases from your left to your right. UC is the least effective, while copper IUCD is the most effective. What do I mean by that? What I'm trying to illustrate is that if 100 women each have unprotected sex once during the 2nd or 3rd week of their menstrual cycle, those who are not on emergency, that never took emergency contraception, out of those 100, 8 of them will become pregnant. Those that use progestogen-only contraceptives like the Postinor, only 1 may come out pregnant. And for those who may have used combined oral contraceptives, if tolerated, 2 will become pregnant. That is what I meant by that arrow in effectiveness. This is further explaining this is now out of 1,000 people. Yes. So how safe are emergency contraceptives? Generally safe and well-tolerated for most women. They are approved by WHO, Food and Drug Administration, and global health bodies. No long-term impact on fertility or future pregnancies. It is suitable for teenagers and adults alike. What are the challenges of emergency contraceptives? You might experience light bleed. There may be light bleeding spotting after taking emergency contraception. When the patient calls, just reassure them. When the bleeding is heavy or happens after one has missed a period, then you need to reach out to a healthcare provider. One of the main signs that a morning after pill, that's a contraceptive pill, hasn't worked is a missed menstrual period. So that needs to be taken note of. And if the periods are delayed more than 7 days, more than the expected date, then pregnancy is suspected and the patient needs to seek for medical attention. Then what are the common side effects? For the hormone, as I said, nausea and vomiting, which is worst with the USP regime, menstrual changes, sometimes they could have breast tenderness, pain, or fatigue. The non-hormonal methods that's the IUCD, can give pain, like pelvic pain, bleeding or spotting in the initial period, the risk of infection for maybe a subtle or an ongoing infection, if not taken note of. Then when are we supposed to call our doctor or go to meet our doctor? In case you feel you're pregnant, if a change in the smell or color of the vaginal discharge is noticed, or you have an unexplained fever or chills, or yes, one experience an abdominal pain or pelvic pain, or when having pain during sex, or have a heavy or long-lasting vaginal bleeding, and there's a missed period within 4 weeks of emergency contraceptive use. Now, I have a quiz, which I will expect people to drop their answers in the chat box, or we can talk about it later. A 27-year-old para 3, that's a woman who has delivered 3 times, married client, calls your office as a doctor or a healthcare provider and says she and her husband noted that the condom was broken after sex the night before. Which of the following emergency will you recommend for that person among the ones I've listed above? Thank you very much for listening. God bless you all.
Thank you very much, Ma, for that wonderful presentation. Thank you very much. Please, let's drop the answer to this question on the chat box. Before she's going to give us, she's going to mark the script I will see the people that have won it, people that have the right answers at the end of the day. So thank you very much, Ma. It was nice. It was nice having you. And there were a lot of things that we learned. I believe many people that are here, they have misconceptions about emergency contraception, Postinor-2 have been changed, their myths, and all other questions that they've been pondering with, they've learned, and there's going to be a change, social behavioral change and communication. So thank you very much. So without wasting time, we are going to have our second speaker, Dr. Idowu Bolutife, who is going to give us a lecture on the myths, reality, and the clinical danger of fake emergency contraceptive. So tighten your seatbelts and be ready to learn, unlearn, and relearn. Thank you very much, sir. You're welcome, and we are glad to have you.
Thank you. Good morning once again. And thank you for the professor who has just given me a soft landing. Thank you so much. Those really helped me significantly. So I'm just going to be going straight to what are the myths that are associated with emergency contraceptions. Okay, first on my list is the fact that there are multiple options. Many people have a myth that we only have one type of emergency pill. That is not true, because we can remember that she mentioned that we have the hormonal, we have the non-hormonal. Another common pill, even another common myth among health practitioners is that, oh, it is called money after sex. I think we should actually change that narrative. Pill of money after sex. Many people actually believe because we call it money after pill. A number of people believe it is only pill. Just like Dr. Sa'adatu has mentioned today, you can also have some devices, intrauterine devices. You can also have intrauterine system like hormonal implants within the uterus. Okay, so without wasting our time, I'll start by saying that the potential association between childhood vaccination and autism proposed in one article in 1998 made a lot of people to believe that when you take vaccine, your child will develop autism, and it was a wrong information. That article was withdrawn in 2010, and since 2010, a lot of information are still out there, still making people to believe that that article was wrong. And that is the danger of media information or information that we get from people around us. As a matter of fact, if you ask people around you about family planning or any contraception whatsoever, you are likely going to hear a bad side of the contraception. But come to think about it, what about a woman who had used it and they are able to control their fertility potential? And that is why it is important to have the right information. And that's what I'm going to be doing today. So the first on my slide here, slide number 10, I don't know if other people can see my slide. It said, emergency contraception has a lot of side effects. That's a myth. And I wrote down that with appropriately prescribed dose, if you use it the right way, the side effects are not significant. And the first presenter has also mentioned that to us. There are a few side effects that can come up, but they are very mild, and they are things that people can live with. And within 1 or 2 days, these side effects will freeze you out. Some of them include nausea, abdominal cramps, tiredness, dizziness, breast tenderness. These are common side effects that can come up, but beyond this, there are no significant side effects. People have said that it can cause cancer, it can make you to have organ failures. This has not been reported in any literature, and so therefore we should know that they do not cause significant side effects. Another myth is that emergency contraception can only be used within 24 hours of unprotected sex. That is not correct, because it can still work up to 3 to 5 days for most pills. And in fact, today we also learned that when you use LNG-IUS, that's either Mirena, Elora, different products, or you use IUCD, it can even be used up to 1 week after conception, after sexual exposure, and that shows that it is still effective beyond 24 hours. So we should have that in mind. Emergency contraception cannot be used repeatedly in a cycle. That's another myth. That is not correct. There are some that cannot be used more than once. For example, if you are using a device like IUCD or LNG-IUS, yes, once you use it once, it will control your symptoms. If you are using LR1, for example, you use it once, it is fine. But you can use LNG more than once in a cycle and it will not hurt you. Yes, it may tweak your side effect profile a bit more, but all the symptoms will still resolve within 24 to 48 hours. Another myth is access to emergency contraception and other contraception will discourage, it will make young people who don't want to have sex to be thinking of sex. Majority of religious body hold this view. It is not true. Access to contraception or use of emergency contraception does not encourage women to have unprotected sex. Rather, I say that it is the true benefit lies in the fact that people know what they are doing. They know they have the right to choose what is right and what is best for them. And it is far more powerful to have this type of information with people than to conceal what could help them. And that can be taken as manipulation, which is not right. Another myth is that emergency contraceptive pill and abortion pills are the same. I hear a lot of this. It is not true. And I need to quickly clarify that emergency contraceptive pill, they are taken immediately after you have unprotected sexual intercourse. They prevent pregnancy. They don't affect already established pregnancy. Meanwhile, abortion pill are pills that you use when you're already positive. That means you are pregnant and you have already done pregnancy test. So they are two different things. Emergency contraception is not in Nigeria, and if it is at all available, they are very expensive. That's another myth. That is not true. There are many emergency contraceptive options in Nigeria. All the things that my first presenter has mentioned today, all of them are available, including the first one, the Ulipristal acetate is even available. When you Google online, you will see that you can see it on all those online platforms. They are available. Yes, Ulipristal acetate has not been widely acceptable, has not been licensed for use in Nigeria. However, you can still get them because they are available, and that's why they are still very pricey now. But every other one, the LNG-IUS, are readily available, and in fact, they are over the counter. You do not need prescription to get them. All right, so they are not expensive. They are readily available. Another myth says emergency contraception can be harmful, and if at all you become pregnant, your baby will be deformed. That is not true. Most emergency contraceptive that we use, most of them have good side effect profile, and most of them will not cause any abnormality on your baby. Babies are safe even when you become pregnant during the cycle that you take emergency contraception. Another myth says emergency contraception can be taken any day, anytime. Well, that can be true, but we also need to remind ourselves that when you take emergency contraception, especially the pills, most of them are working on your ovulation. So they prevent ovulation or delay your ovulation. So should in case a woman take these pills when they have already ovulated, the success may not be comparable. It may be lesser in those who already have ovulation at the time they had sexual intercourse. So they need to also seek the opinion of health workers in order to be completely safe. All right. It's another one says it will kill your fertility potential. Contraceptions don't kill fertility potential, including the ongoing contraception. Emergency contraception have advantage of clearing from your system within few days, and so it does not have a pent-up effect causing alteration of women's fertility potential. So emergency contraception can only alter your menses, but it does not make you to be infertile. So there is another myth that says the morning after pill can be taken regularly instead of birth control. I remember the first presenter mentioned that many people say that. No, it is not correct. Emergency is for emergency. There should be a regular birth control pill. Emergency is only a backup plan when you do not have a regular contraception ongoing. Therefore, it cannot be used as your main contraception. Another myth says obese people cannot use emergency contraception. All right? It is not true. However, there is a bit of concern because the success rates among some women that are using LNG IUS, for example, LNG, that's a levonorgestrel containing pill or progesterone only pill, there is a slight increment in pregnancy rate among those who use the pill when they are obese or they are overweight. But when you look at the total pregnancy rate, it's still about 2. And looking at the range that the first presenter gave us, 1.2 to 2.2, that means it's still well captured, and therefore it is not contraindicated among the obese. It does not worsen their medical condition, and that the outcome is still good. A research has been done and says that if they double the dose, will it improve the pregnancy failure rate? The answer is actually no. Many researches have been done to evaluate that, and the evidence show that yes, the amount of this hormone in the blood become higher, but it does not significantly increase or translate to clinical advantage. Other myths include you cannot use emergency contraception and go back to your regular contraception. The answer is no. As soon as you are back, you can take your contraception, oral contraceptive pill, or you want to do IUS and any other one. They said your weight will increase if you take emergency contraception. No, there are no studies up to date that says contraception, emergency contraception, including the hormonal type, will cause weight gain. No. Future sex is prevented if you take emergency contraception. That will be a gambling. You don't take emergency contraception and then go ahead and take unprotected sexual intercourse. While it can still be protective, the effectiveness is less, in fact, significantly less than when you take it after an emergency, after a sex has actually occurred. Emergency contraception works equally throughout a woman's cycle. I already mentioned that, so we need to be very careful with that. That may not be entirely true. Emergency contraception is not sold to underage. That is also not correct. It is readily available in all pharmaceutical stores, including the people who are not even licensed to sell. That's to tell you that it is readily available, and age is not a restriction to access these drugs, and you do not need a prescription. Another myth says emergency contraception is always prescribed, and getting doctors to prescribe it is even more difficult. Just like the previous one, it is not true. Some of them are over the counter that you just walk to the pharmacy and get. and you do not need prescription. Very few one would need care of a doctor to insert a copati, for example, or a Mirena, for example, but they are all very effective. These are few myths that I came across, and I also want to mention that there are realities of fake drugs. Fake drugs is a disaster. It does not just affect an individual, it affects the community, it affects the nation. It has immediate effect, it has a medium-term effect, and it also have a long-term effect. You can imagine a woman who has had 5 children and has depended on emergency contraception for a mode of preventing pregnancy, only to buy a fake drug. What do you think will happen? She will become pregnant. She carry pregnancy that she's not planning for. She may eventually want to go for a course of treatment for abortion, and she may develop complications from that. Even caring for pregnancy that she is not planning for is a significant drain of resources. It can impact the family. The little money that is available to care for the children that are already available, that money would then go into the care of that woman because she has become pregnant or she has developed a complication from abortion. And these are many more. Or the woman eventually subsequently delivered a new child, making the children to increase significantly. Look at the revenue that we got. Such children are not likely to be taken care of properly, and eventually that will lead to different delinquencies, and eventually it can even be a threat to the community, a threat to every individual. And that is why fake drug should be fought by every means that are available. Effect on the medical team. For example, that woman I just gave you as an example would never trust any form of contraception. In fact, it may be very difficult to trust the medical system in the whole country. And that's how significant the fake drug can actually impact our population. It can also help us when we have fake drug in the community. It alters what the truth is. It alters the perception of people about the healthcare system, and it will also affect policies that are even made, because what should have been made will not be made conclusively. In conclusion, emergency contraception is a safe practice, effective backup method to prevent unintended pregnancy when used promptly after unprotected sex or contraceptive failure is something that anybody should consider. Though it is not a replacement for regular contraception, but it plays a vital role in empowering an individual to make informed reproductive health choices. Thank you. My references are as stated. Over to you.
Thank you very much, sir, for that wonderful presentation. It was a lot to learn, a lot of misconception. One of the things that you said that really, I wrote it down, you said fake drugs does not just affect the individual, but also affect the nation. And fake drugs should be fought. And I'm grateful that NAFDAC is doing a lot to combat that. So thank you very much for this wonderful presentation, and thank you for having you. Thank you for being here. So without wasting much time, I know that a lot of people have questions. You can be dropping your questions on the chat box. Then we'll also give rooms to some persons to speak and ask some questions. So we'll go to the next agenda of today's meeting, which is buying from the right source. Buying from the right source. Like I said, you could see that Dr. Idowu emphasized the importance of the fake drugs affecting not just the individual, but also the community at large. So I'm just going to give a brief overview of buying Postinor-2 from the right source, what you should look out for, and where you should go. So once again, I want to thank everyone that have stayed this far for joining us today, and also for being part of this webinar. So let's face it, we live in a time where access to information and medication is just a click away. Thanks to AI and the rest of them, thanks to Google, people will say ask Google, and most of the information out there, or some of them rather, are not entirely true. So you need to have the right information and know the right place to get your Postinor-2 and other medicines at large. So this is not just for your safety as an individual, but for your community at large. So not every pharmacy, kiosk, or online vendors guarantees the authenticity, quality, or proper storage of medicines. In pharmacy school, we were taught about the storage conditions of medicines. And when it comes to something as critical as an emergency contraceptive, Postinor-2, cutting corners is not an option. For instance, he gave an instance of that woman who already had 5 children, and that incidence is something that is going to be a distrust to her. She's going to campaign against contraception method because of her own experience. So this is not something we should cut corners. So why going to the right source for your Postinor-2? Why is this important? I'm just going to name a number of reasons why it is important to source Postinor-2 for the right sources and what you should look out for. 1, effectiveness of any medication, including Postinor-2, depends on quality. We know that Postinor-2 works best when taken within 72 hours before after unprotected sex. But if the product is counterfeit, expired, or poorly stored, its effectiveness will drop drastically, and you are trusting your future to something that may not even be real medicine. So this is important and is something we should consider. Then 2, fake or substandard products are on the rise. For those of us that are joining from Nigeria, we are aware of what happened within the first quarter of the year, of how NAFDAC sealed all the open drug markets in Nigeria because of fake and substandard medicine. So sadly, we've been seeing a growing number of fake drugs, medications in the markets, and even on social media. You see people selling medications and they are not licensed by PCN to sell. So don't just fall into a victim, expose them and be aware to get your medications from the right place. Then also the third point is health professionals offer proper guidance. When you meet a health personnel, you could see our 2 speakers, you could see their words of knowledge. This is from experience, from training and other things that they have done. So it's good to get your medications, your Postinor-2 from health personnel because they will offer proper guidance on the use of this medication. And also, we have the Pharmacists Council of Nigeria, who is in charge of ensuring that medicines and pharmacies and even we have the AGMPN, offer the right method, the right information to Nigerians and other people in our communities. Then it's also good to get correct usage. When you buy from health personnel, they will give you instruction on the correct usage of the medication. They will tell you about what to screen out, what to check out for, the expiry date, NAFDAC registration number, and the rest of them. Then 4th, when you buy from the right source, you protect your privacy and also your rights. Many trusted platforms in Nigeria now offer discreet delivery and virtual consultations. Like as I mentioned, we have our Access Care, our telemedicine platform. And one of the things that we offer is also our patients' confidentiality, discreet information. So you don't have to compromise the dignity and privacy or the access to Postinor-2 or any other medications that you want to buy. Then there are the things you should look out for. In conclusion, always buy Postinor-2 from a registered pharmacy or a verified e-pharmacy platform. Check for the NAFDAC registration number and the expiry date. Then PPMVs, which are patent proprietary medicine vendors, they can also sell Postinor-2 as long as they are licensed by the Pharmacists Council of Nigeria and they are operating within Tier 1 guidelines. However, only buy from the accredited and reputable PPMVs, preferably Tier 1 or higher, registered with Pharmacists Council of Nigeria, and trained. With SFH have done a lot of training for PPMVs, a lot, Integrity and the rest of them. So they will give you an information about the product. And when they cannot provide information, they will refer you to a pharmacist or a doctor. Then also avoid buying from unregulated drug vendors, informal kiosks, or unauthorized markets at the risk of buying counterfeit or substandard medicines. And Postinor-2 is real and also have been documented. When in doubt, verify your vendor, your PPMV, your pharmacist license, ask for PCN ID, check for the valid NAFDAC registration number expiry date. And also, I want to say this, that Postinor-2 have a mobile authentication system, which is something we call scratch card. So when you buy Postinor-2, you can also scratch it, and it will give you an information whether it is authentic or it is fake. So these are the things you should look out for. When you are in doubt, ask a pharmacist. I say this again, when you are in doubt, ask a pharmacist or any health personnel close to you. It could be a doctor, it could be your shoe. Ask. They will educate you and they will give you all the necessary information you are supposed to know. So like I said, emergency contraception is something that we use, our sisters use, our mothers use, and we should take this information to them. They have the right to access it safely. They have the right to access it confidently, and also the right information. They also have access to that. So let's all commit to helping women, to helping our sisters, our mothers, our cousins to make informed, empowered choices, starting with where to buy Postinor-2. Thank you very much. Thank you very much. So we are going to go to the question section. We have a lot of questions on the chat box. So we're also going to give room to some persons to ask their questions. And also, I remember Dr. Baba asked us a question, and I know that some persons have responded. So I know when she will be answering our question, she's also going to mark the script to know people that got it right, that actually went to school and passed, people that went to school and failed. So let's take some questions. If you have a question, you can raise your hand. We'll give you the room to ask. Then you can also drop your questions. If you don't want to talk, you can drop your questions on the chat box. We'll read the questions and we'll direct them to our speakers to provide answers to us. So if you have questions, okay, so in the absence of anybody raising their hand, I think we'll go to the chat box and we'll take the questions from the chat box. So let me start from the top. Okay, so before we take the question, let me give it to Dr. Baba to give us, she gave us a test. So let's call her to give us the answer to it. Some persons responded. Let's know if they got it right or they got it wrong. So over to you, Ma.
Yes, sorry. Yes, my network. Well, for the quiz question, that woman needs emergency contraception, and she can take, the night before is barely 12 hours. She can take any form of emergency, especially the Postinor-2, which is very available at the counter. She can take even the IC, she can use any method, but the easiest that she can use is the levonorgestrel, which is Postinor, LR, and all those things. You can use Uliprosta, as my co-presenter says, available, but though it might be expensive now, I think the cheapest that is available now is levonorgestrel with less side effects. She can use IUC, the intrauterine devices as well, but she will need to visit the hospital for that, but none is contraindicated actually. Thank you.
Okay, thank you, Ma. So then there is a question from Yemi Dokas Danlati that said, how can we identify the fake drugs? I think my commercial director, the person of Mr. Osareti, will be in the best position to answer this question. So you can be typing your questions while we are taking this. We'll take as many questions as we can. So how can we identify the fake drugs? So please, sir, we'll be glad to have you give us.
All right. Good morning, everyone, and thank you for your patience in attending this webinar. The issue of fake drugs in Nigeria is really now very serious, and almost every important drug in Nigeria has been targeted. For Postinor-2, the first is your source, and that is why we have spent a lot of time here in all the presentations. Where do you get your drug from? So please ensure you first of all get your drug from registered pharmacy premises, accredited patent medicine vendors in your community. That is where you start from. And then once you get it, in terms of the physical appearance of the pack, that is difficult because the criminals involved in counterfeiting, they are also very smart. So it may be very difficult for you to identify a fake Postinor-2 from a genuine by looking at the pack. But one feature that we have included in the original pack of Postinor-2 is the scratch card. So please don't be in too much hurry. We know that you need to take the medication as soon as possible after sexual exposure. So please just take a few minutes, scratch the card and send that SMS to the code that is on the card and wait for the response. Good enough, the code works. You'll get the response immediately and it will tell you if it is a genuine Postinor-2. So please take note, the response is original Postinor-2, not just original product or original medicine. The response will be original Postinor-2. Any other response apart from that, please raise an alarm. That product is suspected to be fake. That is it. And then for if you are in doubt still, the contact numbers of our representatives and even our own contact number in the head office is available. We can even give it to you after this meeting. Call us and we can direct you on how you can get the original Postinor-2. Okay, thank you.
Okay, thank you very much, sir, for that answer. And I believe everyone and the person that asked that question, hope you took notes of all the responses. So we have more questions coming in. And there is one, I'm going to direct this to Dr. Idowu. He said, the use of levonorgestrel Postinor-2 in the management of fibroids and PCOS, is it a myth or a valid point? While he's preparing for that, there's another question I also saw that is more medically inclined. I think I will direct this to Dr. Baba. Let me look for it. Okay, he said, in a month, okay, is it possible for men to be taking contraceptives? So this will go to Dr. Baba. Why the use of levonorgestrel Postinor-2 in the management of fibroids and PCOS? Is it a myth or a valid point? So let's hear from you, sir, on this question.
Okay, so the question says the use of levonorgestrel or Postinor-2 in the management of fibroid and PCOS. The two conditions that were mentioned, they are actually a long-term situation. And the drug you are going to use, the dose is significantly low to the extent that it will not do anything on those two conditions. For example, while we know that there is a kind of, in fact, if there is going to be any impact, it is ulipristal acetate that could influence fibroid. Levonorgestrel will not. The only form of levonorgestrel that has an indication of use in in fibroid is actually the LNG-IUS, the one that they will put inside the womb to be able to control the bleeding. So it's a myth. It's wrong. It's wrong. And therefore, nobody should prescribe or use or buy Postinor-2 in order to treat polycystic ovarian syndrome or fibroid.
Thank you very much for that wonderful answer, and I have learned too. So let's hear from Dr. Baba on the question about men using contraceptive.
Yes. Yes. Thank you very much for that question. And I thank the audience for their patience and for the question. Well, yes, there are contraceptive methods available for men, although the options are limited compared to what we have for women. Currently, the primary ones we have for males are the condoms, which is a barrier method that prevents sperm from reaching the egg. Then we have the vasectomy, which is a surgical procedure. And we know that that is not something that the men like to do because it's a permanent method, especially African men, even their foreign counterparts. But a few in this day and in a few people are coming up to vasectomy, but the numbers are still very, very, very low. Then we have the withdrawal method. This involves the withdrawing the penis before ejaculation, although it is not as reliable as other methods. And you remember, it's one of the reasons why I said emergency contraception can be used, that both condom and withdrawal method. If condom, there's breakage, there's slippage, and all those things, you can have to use emergency contraception by the woman. And in terms of withdrawal method, if after sex, the intercourse, the woman notices that the vagina is wet or there's a vagina, there's sperm in the external genitalia or sperm has stained her, is one of the reasons that she has to use emergency contraception. However, research is ongoing to develop additional male contraceptives, such as the pills, gels, but they are not yet widely available, still at research stage. Thank you very much for listening and for the question. God bless you.
Thank you, Ma, for that wonderful answer, and we are grateful. So we still have more questions coming in, and let me take this one. I think my commercial director will be in the best position to answer this. I think I can even give him 2. He said in a month, that's in a cycle, how many Postinor-2 can one take? I know the presenter made mention of this, but let's give this question to my commercial director. Then the next question also is, how do we know the right emergency contraceptive to use at a particular time? So I'm directing 2 questions to him. Why there are 2 other questions that said, thanks for this wonderful presentation. Can we have recording of all the presentations to our Gmail? I think we can do that if you registered, but my commercial director will comment on this too. Then is there a way all these lessons shared today can be spread to a wider community? My commercial director will also comment on this too. So over to you, sir.
Okay, all right. Thank you once again, Onos. The first is the frequency of taking Postinor-2 within a single cycle or in 1 month. Like the consultant said during the presentation, it is called Postinor-2 is an emergency contraception. So an emergencies or accidents should not be happening every day. Okay, so but scientifically, as a company and also from the product information, Postinor-2 is not a routine contraceptive. So it's not what you use as a routine contraceptive. We recommend maximum of taking it twice, that is 2 times within a single cycle. So if you have used in 1 month, then 1 more time is enough. Like the consultant said, it's not as if taking it more than twice is harmful, but the risk of side effect and the risk of having severe side effect increases when you now use it more than 2 times. So it's recommended don't take Postinor-2 more than twice in a month. So if there is need for regular use of contraception or contraceptives, we have routine contraceptives. We have the combined oral contraceptive pill, which we call Combifem. That is the daily pill that you can use when you need regular contraception. But for emergency contraception, is recommended twice, maximum twice in one single cycle. All right, thank you. What is the other question?
Okay. You actually have 4 questions, although the other ones are just a wrap up. So how do we know the right emergency contraceptive to use at a particular time? Then the last 2 questions, which is asking if we can get the slides on the Gmail, and is there a way we can spread this message to a wider community?
Okay, as for the slides, the slides are the intellectual properties of the consultants, the presenters yet. So we will have to speak with them on that. So, but drop your email. You can drop your email. If you register, we have your email. And so any other information you need about Postinor-2 and emergency contraception, we can always send to you. Sorry, can you go over them again? The other questions. The right emergency contraception to use. Now, in our environment, if you follow the presentation, the one that is readily available and accessible is Postinor-2. Nigeria, by regulation, Nigeria allows it to be dispensed over the counter. That means you don't need the prescription from the physician to get it. You can go to your pharmacy, you can go to your nearby patent medicine vendor and get Postinor-2. So because one characteristic for a contraceptive or for a drug generally is access. You need to be able to access it when you need it. And so that is where the advantage of Postinor-2 is. You don't need to go to the clinic to get a prescription. But if for any reason you need other types of emergency contraception like the LNGIUS, which we also have. We have Avibela, and like the consultant said, you need expert, not just expert advice, an expert also have to administer it to you. It's just not what you use on your own. So for ease of administration, ease of procurement, access, cost, and all those advantages, Postinor-2 is a preferred choice for emergency contraception, and also is also very effective in preventing unintended pregnancy. How do we get this message to the people outside? So if you are here now, you are now appointed an ambassador for good health. Okay, so take the message out there and let people know if they have unintended sexual exposure without condom, they don't have to take the risk of bearing an unintended pregnancy within 72 hours. There is something they can do to protect themselves, so they can go to their pharmacy, see their pharmacist, or go to the nearest patent medicine shop, and get a dose or a pack of Postinor-2 and take it immediately. So that is the message. And then they should ensure they get the original. Go to a pharmacist that they trust, not just anywhere. And then they should scratch the card, test that code, and wait for a response. The response is original Postinor-2 before they take it. If they don't get that message, or if they don't get that exact message, they should drop it and, in fact, call us and inform us that a fake product has been detected somewhere. But there is no need to be scared. The original Postinor-2 is available there. We have our distributors, and you can also contact us directly, and we can direct you where you can get the original Postinor-2 out there for your use. So that is the message from this place. So everyone who is listening, who is on this call, please take that message out there, and you will do your own part in contributing to public health in Nigeria. Thank you.
Okay, thank you very much, sir. Thank you for those answers. So we just have 2 questions that came in, and I think we are still within our time scheduled for this webinar. So we'll take them. The sentence for this presentation: if a patient have unprotected sex and takes Postinor-2 immediately, if the patient has sex within 72 hours, is it advisable to take another one after 72 hours? Let me take it again. If a patient have unprotected sex and takes Postinor-2 immediately, if the patient has sex within 72 hours, is it advisable to take another one after 72 hours? So let me direct this question to Dr. Idowu. Then the last one, I will direct this one to Dr. Baba. He said, we thank you for this amazing presentation. Our question is the effectivity of Postinor-2. Is this like 75% or more? But I think I will answer this. So let's take this too. Let's take this one. If a patient has unprotected sex and takes Postinor-2 immediately, if the patient has sex within 72 hours, is it advisable to take another one after 72 hours? So let's hear from you, sir, Dr. Idowu.
Hello, can you hear me?
Yes, sir, we can hear you loud and clear.
So for a woman who has just taken Postinor and is still within 72 hours, you do not need to take additional one. There is a research that was done to evaluate pre-sexual exposure effectiveness of Postinor levonorgestrel. While we know that it is not as effective as when you take it after the sex, but there is still up to about 75 to 80% success in preventing unintended pregnancy, even when you take it before it. So the one you have taken to cater for the first sexual exposure that you had, since it's still within your system, is still going to take care of your conception, if at all you're going to have one. So you do not need to repeat that dose within a 72 hours period. It will only increase your side effect profile. All right.
All right, thank you very much. Thank you. I think we should still give this question to Dr. Baba. I think she will answer this better than me. He said, what's the effectivity of Postinor-2? Is this like 75% or more? Is she with us, Mark? Okay, if she's not here, let's give it to our commercial director, Pharmacist Society. The person is asking the effectivity of Postinor-2 and is asking the specific the percentage.
Say the effectiveness, you mean the effectiveness of Postinor-2?
Yes.
Okay, yeah, if you also follow the presentation, for emergency contraceptives, when taken as directed, that is within that 72 hours, generally they are noted to be effective up to 99% 99% in preventing unintended pregnancy. Okay, so that is generally. For individuals may vary, and then the fact is the earlier it is taken, the more effective. So you discover that from that 3 days to 4 days to 5 days, the effectiveness actually declines. So the rate of pregnancy might be increasing. So for better result, it is advisable to take it as soon as possible. Within 12 hours, within 24 hours, within 48 hours, you have better results. So you don't need to wait. And I actually advise most of my colleagues, pharmacists in practice, that when people come to buy Postinor-2, I usually recommend the DOT approach, that is directly observed treatment. What does that mean? Once you buy it, in that place, ask for water and take it immediately. Experiences have shown that when people buy and they drop it in their handbags, usually they forget. And then the next time they remember that they bought something, probably the period has passed. And you know what that means. That is, the next thing is you have to go to antenatal clinic. So I observe DOT, directly observed treatment. Wherever you buy it, ask for a bottle of water, take it immediately before you go home. So it works better. Thank you. So that is also a message to take out to, that is also a message to take out to your friends and your colleagues. Wherever you buy Postinor-2, take it there. Thank you.
Thank you very much, sir. Thank you very much for your answer. So this last question, I believe this Unandi came late because this was actually discussed in the course of our presentation. So I don't know if we should take it. Okay, since it's the last, this is the very last, we'll just take it. Although it came late because this was mentioned. So the question is, sir, please. It said that Postinor-2 don't initiate abortion, but it's still effective within 72 hours while on the peak of ovulation. Fertilization takes place within 0 to 3 hours. So I will need more info on that because it sounds, I believe you wanted to write contradictory. So this is the last question for the day. I will give it to Dr. Idowu as a follow-up on the last question he answered. So over to you, sir.
Thank you very much. If I get the question right, you said Postinor-2. I said Postinor-2 does not initiate abortion, but it can still be effective up to 72 hours, right? And that the writer says the fertilization takes approximately about 0 to 3 hours. So how would that occur? So you need to have, we're going to have a physiology class now. Okay, so when a woman is about to ovulate, the period that we call ovulation period, or what we call the fertile period, is actually not a short period of time. Even when you start to have all the symptoms of ovulation, it doesn't mean that you have even ovulated already. Some of them are signs of actual ovulation, and it takes time. The best way to know and track what actually happened is to be measuring your LH, luteinizing hormone. And we notice that the LH surge actually takes some hours before ovulation will eventually take place. So it is not something that happens within 1 to 3 hours, like you mentioned. So preventing LH surge, which occurs when you take this LNG, it takes time. And that is why it continues to be very effective even days after. And again, if that egg is even released, the chance that it's going to fertilize is not happening within 0 to 3 hours. We need to also note that there are other conditions that need to be met before fertilization occurs. All right? I hope that answers your question.
All right, thank you very much, sir. Thank you. So you can follow us on our social media platform. We are on LinkedIn, SFH Access, we are on Facebook, we are on Twitter. And also you can access the presentation by subscribing to our YouTube channel at SFH Access. For more information on getting our genuine Postinor-2, contact us directly. The number is on the chat box, 0806-221-6460. Stay connected with us to learn more about Postinor-2 and the full SFH Access Health product portfolio. So we have other health portfolio. Stephen, kindly take us to the last slide. We have other health portfolio apart from the Postinor-2. You can we have our different variants of Go Cycle Classic, Go Cycle Studded, Go Cycle Strawberry. Then we have different variants of our lifestyle condom. We have Postinor-2, which is the topic of the day. We have Flex condom, and also we have Temisatan. We have today's meeting. We want to appreciate every one of you who has joined us, who has been part of this discussion. And I believe you have been able to learn one or two things. And I want to close by saying access to emergency contraception is a right. For safety, it as when you use it. So let's continue to encourage ourselves, our friends, and our communities to buy Postinor-2 only from licensed, trusted sources, and always seek out clear, correct information from qualified professionals. Our commercial director spoke on this elaborately. By choosing wisely, we protect not just our bodies, but our future. We can remember one of the statements that Dr. Idowu said. He said, fake drugs does not just affect the individual, but also affect the nation. And fake drugs should be fought. And that is why you see NAFDAC fighting. And I believe that one day they will conquer the war against fake drugs in Nigeria. So once again, thank you for being part of this session and for standing with us in providing and promoting safe, informed, and dignified reproductive health choices for every woman everywhere. So stay empowered, stay informed for other of our webinars. So we're going to bring this webinar to a close we started with our national anthem. We're also going to close with our national anthem as well. So Stephen, please kindly help me so by the count of 3, we are going to recite our national anthem. So 1, 2, 3, go. Nigeria, we hail thee. Our own dear native land.
Dear native land.
Though tribe and tongue may differ, in brotherhood we stand. Nigerians all, and proud to serve our sovereign motherland. Our flag shall be a symbol that truth and justice reign. In peace, or battle
honored.
And this we count as gain.
To hand
unto our
children a banner
without stain.
O God,
of all creation,
grant this
our one request.
Help us
to build a
nation where no man is oppressed. And so
with peace and plenty,
Nigeria will be blessed. Amen.
Amen.
Amen. Thank you once again. Thank you, everyone.